Non-communicable diseases are a silent epidemic affecting millions worldwide. In Uganda, like many other countries, NCDs such as cardiovascular diseases, cancer, diabetes, and sickle cell disease are on the rise. These conditions account for 33% of total death in Uganda, with a 22% probability of premature mortality from the four main NCDs for every Ugandan citizen.
My name is Dr. Nachireka Susan Tumwesije, and I am a specialist physician who has specialized in managing non-communicable diseases. I'm also an executive member of the board of the Uganda NCD Alliance and the president-elect of the East African NCD Alliance. Non-communicable diseases are a big problem. They are a threat to the health of the people in the globally, and they account for 41 million deaths annually globally, and this contributes to 71% of the deaths of people in the world. Now, non-communicable diseases are diseases that are not transmitted from one person to another. You cannot sit next to someone and you get a non-communicable disease.
Dr. Nachireka emphasizes the importance of lifestyle changes, including eating locally grown fruits and vegetables.
There are many risk factors for NCDs, but those that are really contributing so much to these non-communicable diseases include unhealthy diets that are high in cholesterol, high in sugar, high in salt, and yet they are low in nutrients. People eat more what we call junk food, the foods that contain wheat, high carbohydrate content, fatty meats and those fatty foods, and they eat less of the fruits and vegetables. This contributes to non-communicable disease. Then physical inactivity. People are sitting more than they used to. They sit at work, they sit at home, they sit on their way to work, and so this one also contributes to the non-communicable diseases. People gain weight. Obesity is a problem because of not being physically active. Then other contributors include tobacco use. Tobacco in all forms, the chewing tobacco leaves, the pipes, the electronic cigars, shisha, and all the other forms of tobacco also contribute to NCDs, as well as harmful use of alcohol. Taking alcohol in quantities that are harmful to the body also contributes to NCDs. And other contributors of NCDs include air pollution. Air pollution is now a problem, which is a very big global problem, and it is also now a contributor to NCDs, including respiratory diseases. Because we are no longer eating healthy, the problem, like I've said, is the unhealthy foods are easily accessed. They are easy to prepare. It is easy to deep fry food. It's easy to find the chips and what at the roadside. It is easier than for someone to prepare a proper meal which is healthy. Our proper traditional meals where you cook your sweet potatoes, you cook your cassava, you cook your homegrown food, and also vegetables and fruits. So,
however, access to NCD treatment remains a challenge, with the priority often given to infectious diseases like malaria. Additionally, Uganda faces a shortage of trained health workers to manage NCD clinics.
We are encouraging people to get back to the food production within their homes, the non-cash crops, the foods that can be grown within the homestead, and make use of those foods, including the fruits and vegetables. Another challenge of availability of NCD services is that This is something, the problem is really quite big because the health facilities have previously been inclined towards managing infectious diseases, tuberculosis, malaria, HIV, and those services actually have been really so much provided at a subsidized rate. Now, NCDs are something that is not yet funded very well. It is very expensive to manage non-communicable diseases.
Bandi mukiiko naaba nefuna stroke tewali muntu yadde n'omu nawalirizibwa nenewaliriza era awo nagwirawo ebigo bibiri ebyankoze nnyo saidi eno nentuuka mu kisenge nenyambala olugoye kati nembeerawo mpaka abananyambala lwe banajja bakomawo kiro sawa zalinga 4 kati ekyo kiro tetwasobola genda mu ddwaliro kolo lwennyini then ne tugenda enkeera ne bansikaninga stroke yali ngenzi ku mutwe ku bwongo ne bampa eddagala then namalayo weeks 2 n'ekitundu nga bakyanjijanjaba
Living with stroke is challenging. Have lost her ability to work, faces discrimination, and struggles with the medication costs.
Okusanga mu lugendo luno lutolubadde lwangu kubanga challenges nyingi zize zibaawo oluusi okujjanjabibwa okugula eddagala okwejjanjaba naye oluusi n'abeera nabo bo baba balowooza nti oba waggwaayo emikisa gyo gyaggwaayo ekyo nakyo nekikuwa challenge.
There is still a problem of availability of services to manage NCDs, including the trained health workers who can manage properly a patient with cancer, diabetes, heart disease, stroke, and others. So that's still a problem, but also even the NCD clinics are fewer. There is no space, there's no designated space to manage these clinics, to manage these patients, as well as other health workers.
Emirimu gye nakolanga gyaggwaawo ekyo kyankoseza ddala nnyo mu byenfuna kuba omulimu kati siina olw'ensonga nti nali ndi mukazi ayeeyiya atunda omudaala nti neekozesa kati oba tosobola lekawo muntu nti nkolera kiba tekisoboka ekyo kyo kyankosa nnyo era kyekikyankosa nakati ti ebyenfuna.
But she remains hopeful, noting that stroke recovery is slow, but with therapy and exercise, she sees improvement.
Kakyuka weeri okuva natandika okujja wano kuba we nasookera okujja wano nga sawa kwetambuza nti neeyimirize neetambuze nga nkankana nzenna naye kati neetambuza nsobola okwenaaza nsobola okwetuusa wonna we mba njagadde nsobola okubaako kye neekolera like ng'okoza akatambaala engatto zange obuntuntu obwo obutonotono nsobola obyekolera kale ne mu bulamu ngenda era mpulira omubiri gukola ki exercise zetukola zinzizaawo mpola mpola. So okuwona toyina kupapira bukwa stroke kubanga bwokupapira oluusi towona naye kugenda mpola.
Hello, my name is Don Magezi. I'm 33 years old. I have sickle cell anemia. 3 of my siblings have sickle cell as well. Growing up, it was quite difficult at times, but with the help of my parents, family, and friends, I've got to live quite a generally healthy life for having sickle cell. My message to other warriors, as we call ourselves, keep up the good fight, never give up. There's always support if you need some. You can find Rare Mark Foundation.
Magezi highlights the high cost of medication and urges the government to invest more in sickle cell support.
What I'd really want to say to the Ministry of Health is I wish we could encourage and put in more money into supporting people with sickle cell anemia. It's not really recognized as a non-communicable disease, and I think it needs that attention in the media and so on.
He emphasizes that sickle cell is not a death sentence and can be managed with proper care.
Thankfully, this year Uncda has reached out to a number of organizations, us included, and they're fighting really hard to make us part of the Non-Communicable Disease Alliance group.
The status of sickle cell according to Uganda is that the Ugandan population now, as per the published statistics, is that we have 13.3 of our population in Uganda having sickle cell disease, and we lose 25,000 children every year before they make it to their 5th birthday. So it is so alarming in a way that even the medication that would suppress the pains that we get, one tablet costs 1,500, which is so painful, of which our people in the community may not be able to afford.
I am a lawyer, but all my life I studied as a type 1 diabetic. So it hasn't stopped me. The only difference between me who has diabetes and somebody who doesn't have diabetes is that I have to inject my insulin and they don't have to. That's the difference. If I listen to my doctor, I share with my friends what I'm going through, nothing is going to stop me. And I know sometimes it can look bleak, it can look bad, it can look like there's no hope, but I can assure you it's not the end of the world.
With more Ugandans falling victim to diabetes, organizations like Uganda Diabetes Association are pushing for increased awareness and better health care services.
Uganda Diabetes Association is a non-governmental organization, non-for-profit organization, which advocates for and unites care about the Ugandans with diabetes in Uganda. And our mission, our vision is a Uganda with a reduced rate of diabetes and also care for Ugandans with diabetes. Our mission also is to prevent diabetes and reduce or improve the quality of Ugandans with diabetes through providing education of diabetes to them, through providing or through building capacity of professional health care for diabetes.
Organizations like the Uganda NCD Alliance, Uganda Diabetes Association, and Sickle Cell Research Foundation are actively working to improve healthcare access, raise awareness, and advocate for policy changes.
The burden of diabetes is substantially increasing in Uganda, with the approximately 500,000 plus adults living with diabetes in Uganda. That's how bad we are. And it is eventually growing.
In 2014, when they did the STEP survey, 1.4% of Ugandans, which translated to about between 600 and 700 Ugandans, had diabetes at that time. In the 2023, which was survey which was done, that number has increased to 3.3%. And if you had to put it in numbers, we have about 1.7 Ugandans with diabetes. That is almost more than twice the number that we had about 10 years ago. Now, the numbers wouldn't be, somebody who is listening to me or seeing me would say, but that is a very small number when it comes to the 47 million Ugandans we have. Like Chris said, when you have 5 diabetics diagnosed, there's another five people with diabetes who do not know. So more than 50% of Ugandans do not know that they have diabetes.
The Ugandan government, in collaboration with these organizations, is making efforts to improve NCD healthcare services, but much more needs to be done to ensure accessible and affordable treatment.
That wouldn't be a problem, 20% of what, 25% of what is living with high blood pressure. But what is a big problem is that 80% of those living with high blood pressure do not know. They are walking. And even those 80%, I mean the 20% who are being diagnosed and on treatment, about 10% of them are ones who have their blood pressure controlled. So even the 90% of those with high blood pressure who are on treatment, their blood pressure is not controlled. So they are also at the verge of developing complications.
NCDs are not just a health issue, but they are a national crisis. Prevention through lifestyle changes, early diagnosis, and better healthcare infrastructure can save lives.
One of the challenges of food is also the schools, the school-going children. They eat completely unhealthy food, which is completely not, these things, they packed foods, the juices and all those things, and soft drinks and all that. So
the fight against NCDs requires a collective effort from individuals, healthcare providers, and the government. The battle against NCDs is far from over, but with continued efforts, awareness, and support, a healthier Uganda is possible.